Good afternoon, everyone. Thank you very much for joining me today, where I will present to you how we were able to institute as a team a very important policy change within the Horizon Health Network, which is the launch of the new official languages policy. Now, just to provide a bit of context to our endeavor here today, in the fall of 2015, I was hired as the official languages advisor for the Horizon Health Network. The primary responsibilities of my role were to enact any and all provisions of the Official Languages Act as they pertain to Horizon Health Network. Now, this included, for example, providing training to all of the employees of the Horizon Health Network on the provisions of the Official Languages Act, how they pertain to them. It was also about conducting official languages audits and responding to any and all official languages complaints. Now, within my tenure, after about 3 weeks, I was asked by my manager to be able to rewrite the official languages policy for two reasons. Number one, the policy was about 11 years old, and some of its provisions within the policy were just simply out of date. And the second, the new Official Languages Act revisions had just come into place, and the Horizon Health Network Official Languages Policy was simply not ready to be enacted and put all of these new provisions into place. So I rewrote the policy for about a month, got it approved at all levels, and then we proceeded to be able to find a good way to be able to integrate this and find a good path to success to integrate this new policy within our organization. So in order to make sure that this policy launch was a success, we focused on 4 different areas: planning, communication, execution, and sustaining. The first phase, the planning phase, was all about us asking the right questions and making sure that those questions had full answers. What is our reason for change? Who will the change affect? What are the timelines that we want to use in order to execute this change? Who are the key stakeholders? What are the steps that we want to follow to be able to get to this change? And finally, how we measure success. Now, once we had answered these questions as a team, we were able then to develop this into a planning document for all parties to be aligned as to how we were going to do this. This was focused not only on the answers of these questions, but also focused on everybody being aligned to this change and having a common vision around that change. Once the document was approved by our senior leadership team, then we proceeded to do 2 things. We engaged HR to develop training modules around which every level within Horizon Network knew what they were responsible for within this process, and we had to confirm our direction with legal and HR because it was the enactment of an Official Languages Act. We wanted to make sure that we were aligned. In terms of our communications phase, it was about engaging the proper stakeholders at first. We had to engage internal stakeholders such as managers, supervisors, the leadership team, and also the union groups to make sure that they all understood under the policy what would be their new responsibilities. Now, externally, we engaged patients, community groups, and also advocacy groups. And there the message was a bit different. We were trying to make sure that they understood why we were doing this and how this protected them and their interests. Our efforts within the communications phase were all about clear, consistent, and focused messaging. We developed 2 different frequently asked questions documents that we did, one for the internal stakeholders, one for the external stakeholders, and using trying to anticipate the questions that they might have and answering them in advance. And again, we were very focused on having a singular direction, addressing the questions with clear responses, but not to be redundant in our efforts. We also tried to adapt our messages to the stakeholder, making sure that stakeholders, such as patients, didn't have the same level of knowledge of the Official Languages Act. We tried to adapt all of our messaging to the various groups that we were going to talk to. And again, also we were very focused on addressing resistance to change. 2 different resistances that we were addressed. Number one, what I like to call passive resistance, which is the resistance to any kind of change within an organization. For this, we made sure that the groups understood that we were not necessarily changing the amount of work that they had to do, simply a little bit of the nature that they had to do, and also how it might affect them in the long run. If it was active resistance, which is more of a political stance versus in the language debate in this province, we made sure to inform them that when they signed and they were when they were hired within the Horizon Health Network, all political stance had to stay at home, and when they worked for them, they had to follow the provisions of the policy. The execution phase was all about rolling out the training to the employees, making sure that the training sessions that were led by us, the official languages advisors, were all about being interactive, engaging, dynamic, following the message that was supposed to be followed, and answering any and all questions that they may have. Then finally came the launch date, which was we made a big event where everyone could ask their questions in person, be able to meet the main stakeholders in this, and be able to interact. It went very well. And during the execution phase for the next few weeks, we were all about assessing where we're falling short and following up with employees and management team where there might be some resistance left. It was all about sticking to the plan, seeing it through, and being persistent and consistent in our messaging. Finally came the sustain phase. This is us taking the execution phase and making it sustainable long term. First of all, we had to held regular debrief meetings with senior management for them to understand how everyone in their portfolio was acting in regards to the change, and making sure that we could address any and all resistance again, and making sure that long term we were able to diffuse this. It was also about assessing our successes and failures, making sure that we had a continual improvement model where there were victories that were celebrated, when there was any kind of failures they were addressed, and providing additional training where this may be new employees being brought in at the same speed as the employees that were already training, etc., etc. We had to follow up again with the key stakeholders, both internal and external, to make sure that they were happy with what happened and they were aligned with a new direction. And finally, it was very important for us to celebrate the wins, because as we know, in any policy change, it can affect a lot of people, and we just wanted to make sure that everybody was happy with what happened. This is a little bit about what happened in a policy change. I would like to thank you very much for attending today, and I will open the floor to any questions you may have. Thank you.